Prone, knee flexed, dorsiflexion stretch. Have your client lay prone. Then bring their involved side into a knee flexed position at about 90 degrees of knee flexion. Next, grasp near their Achilles tendon at the superior aspect of the heel. Okay? And then you're going to pull up. So this hand will pull upwards while this hand presses downward on the ball of the foot. As you're applying the stretch and as you go into the stretch, before you really start feeling end range of motion, you want to ask your client, on a 1 to 10 scale, how much stretch do you feel?
5.
They feel 5. So you can go up to 6.5, maybe at the most, if your client's very well adapted to mobility, their tissues are used to being worked on, they have good tensile strength, they have healthy joints and structures, you could go up to a 7. That's the highest that you would go with this. Most clients, depending on who you're working on, it may be very difficult to even get to a 5 because the ankle is very strong. So you're going to pull up and press down. Now the other way that this can be done very similarly is you can use your forearm and your shoulder musculature to pull down, pull your elbow down by gently holding on to the heel and then pulling the forearm down. And that applied stretch would look like this. So on a 1 to 10 scale, how much stretch do you feel?
6, 6.5.
So the client feels 6, 6.5. And this can be a way to apply this stretch with even more force if you're having difficulty applying the stretch from this position. One more additional note, a little clinical pearl for this stretch. Versus the knee extended, in this knee flex position, we're going to be focusing much more on the inferior tissues of the lower posterior chain, including primarily the soleus, but also having some additional impact on Achilles and even the plantar fascia of the foot because of the way we're stretching the client.